Hello, my dear future nursing officers. I welcome you all once again back to the Master Nursing classes. In this very important session, we are going to discuss the most important clinical questions where there is an highest chance of striking is there in your exams. So here, what questions we are discussing is completely a scenario based, practical based, and the clinical cases. So because somewhat there is a change in the level of the Norcet exam, so we can't expect the same thing which was came in the last 4 to 5 years. So the thing is little bit different now. The competition is little bit high now. So the question will also come according to that. So we have to keep our 5 step ahead than the examiner. We have to prepare in a such a next level. So where we are preparing for the a very advanced thing. So if basic thing also covers and advanced thing also covers, so the success rate will be high. And we are only sticking in the things where we can't able to interpret that one and we are unable to analyze and give the correct answer in the option means that is going to be somewhat difficult, right? So here I am making you a very fit to how to choose the keywords from the question and how to choose the correct answer. So just not only giving the knowledge, along with the knowledge, I am training you how to solve the MCQ in a very perfect direction. Okay, so let's begin the session without wasting a single minute of the time. A very good evening to one and all, and I welcome you all once again back to the Master Nursing classes. If any one of you are new to the our Master Nursing classes channel, so please do subscribe to the channel. And everyone who are live to the session, so fटाफट hit the like button and please do share the class with your friends, with your colleagues, in your hospitals group, in your college groups, so that you can support the Master Nursing classes directly, indirectly, right? So let's begin the session without wasting the time. Okay, so here it comes to the first question. Very good evening to one and all. So here it comes to the first question. So please do take the question as a very simple question I am giving for the first. So try to give the answer for this, right? So while administering the ear drops, so this was the question of the assignment of the last class. Okay, so what we have conducted the last very beautiful session. So this was the last question of that class where I have given for the assignment. Okay, so here is the question we have. While administering the ear drop to a child, how should the pinna or the auricle be pulled to straighten the external auditory canal? So the question itself arises from the question. So why we have to pull the pinna in a administration of the eardrum? Because we have the external auditory canal in a S shape. Okay, it will be there in the S shape like this. Okay, so in order to make it straight, we have to pull the ear auricle or pinna, what we can say. So how we have to pull this one in a case of the child? Okay, so here the age is the going to be a decider. Okay, so if the examiner asking for the child, so we have to put the answer as the downward and backward. If the examiner asking for the adults, that is the upward and backward. So here the examiner asks the question for the child, so our answer goes to the option C, that is we will pull down, we will pull back. Sir, how to remember? So the child means height will be down, height will be low, right? So we are pulling the pinna low, and backward is same in the both. Okay, so here also backward we are pulling, here also backward we are pulling. So adult means high height, pull up. Okay, so high height pull up, low height pull down. Okay, so I hope it is very much clear, right? So this is how we have to remember, right? So here I want to give some golden point that is much necessary for your exam. Okay, so these golden points are very important. Sir, if in a question the examiner not mentioned the child and adults, he mentioned the age group, then what to do, sir? Then you have to remember here in this particular situation what I explained, the child in the sense that is less than 3 years and more than 3 years means pull up. Okay, so if it is more than 3 years, you have to pull it up and back. Less than 3 year, pull it down and back. So the 3 year is the very important key decider here. Okay, so 3 year. Okay, so less than 3 year, pull the down and pull the back. Okay, so like this you can see here we are holding and we are pulling down and back. Okay, so and here we have in the adults pulling up and back. Okay, so I hope it is very much clear. So here are the golden points, very important. The too cold and too hot eardrops we can't instill in the ear because that may causes the damages to the tympanic membrane and that may irritates the ear like anything. So whenever we are instilling the eardrop, make sure that the eardrop temperature should be equal to the body temperature before the administration. One very important point. Second is position of the patient. So that is we are giving the lateral position. In the laterals are which right lateral or left lateral, that is depends on the which ear is defect, which ear is having the defect. If the right ear is having the defect, right ear should be facing upward, and the left ear is having the defect, left should be facing upward. Okay, that is the lateral position with the affected ear facing upward. So this is the very important thing, remember. And to straighten the external auditory canal, already told, more than 3 year upward and backward, less than 3 year in the children downward and backward, we have to pull the ear auricle or the pinna to make the external auditory meatus or the external auditory canal straight. I hope it is clear. And most important, we should not touch the dropper tip to the ear to maintain the aseptic technique. Okay, so if you are touching the dropper tip to the ear, means the container which is having the medication that will get contaminated. So that is the reason, most importantly, you have to understand, you do not touch the dropper tip to the ear to maintain the aseptic technique. So this is the very important thing you have to keep in your mind. And most importantly, after instilling, we have to press the tragus like this, 1 time, 2 time, 3 times, 4 times, like multiple times we have to press the tragus so that the medication can enter the ear canal perfectly. Okay, if it is staying in the superficially, means so that is not going to help. So the very important, what the nursing officer will do to properly pull the to properly push the medication into the ear canal. So that is we have to press the tragus gently for the several time. Okay, yes. And most importantly, after instilling the eardrop, you should not immediately change the position of the patient. So ask the patient to remain in the same position for the 2 to 5 minutes. So this is very important golden points you must and should remember. So if the scenario based question is generating, means the question will comes from these golden points. This is for your exam. So please do remember this one. Okay. Yes, sir. And here it comes to the next question. So the question is very simple and most important. So yes, the very good, simple and important question. Okay. Here I hope you people will get confused. So let me clear this one. Okay. So the question is, a 30-year-old patient is there who is presenting with a progressive conductive hearing loss. Okay. So which problem is there here? So here we have the conductive hearing loss. Okay. It means the problem may be in the external ear or else in the middle ear. If sensory neuronal hearing loss is there, means that is the problem in the inner ear. Okay, so here we have the conductive hearing loss. It means we have the problem in the external ear or in the middle ear. Okay, and we have done the otoscopic examination, which is showing that there is the positive Schwartz sign. So Schwartz sign is positive here. And investigation reveals that the fixation of the stapes to the oval window due to the abnormal bone growth. So as I shown in the last class image, so one more time I will try to draw. So this is, we are having the external here. Okay, this is the external auditory canal we have. Here we have the tympanic membrane. So here we have the malleolus. Okay, and here we have the middle bone, that is the incus, and here we have bone, this is called as the stapes. Okay, this is the stapes. So this one we call as the foot plate of the stapes. So this is the foot plate of the stapes. So this foot plate of the stapes, here we have the vestibulum. Okay, so here we have the one hole, this is called as the oval window, and this was the round window. Okay, so our foot plate of this stapes is attached with the oval window. Okay, so here what happened? So here there is an over or extra bone growth happened, and which is not allowing this stapes to move. Okay, it is keeping the stapes fixed here only. It is get fixed here. It is not allowing to move. So what happened here? This condition, what we call, so this one we call as then the otosclerosis. What we call this one? So we call this one as the otosclerosis. Okay, so this is the otosclerosis, right? So is this a question? No, examiner is not asked what is the diagnosis. He is asking one more step forward he went. Okay, so there is in the investigation we done. In that one there is in the fixation of the stapes to the oval window. Means the stapes is attached to the oval window due to the abnormal bone growth around our stapes bone. What is the definitive surgical management of this condition is the question. Option A, we have the tympanoplasty. So the problem is there in the foot plate of the stapes and the oval window. So you are making a repair of our tympanic membrane. So there is no any sense in that one. So I am eliminating the option A. Then mastoidectomy. The mastoidectomy means there is in the removal of the mastoid process, which is just there above our middle ear. So that one we will do in a case of any infection and inflammation of the mastoid. Okay, so that now we are not doing anything. So that is option B also going to be a wrong here. Then myringotomy again. So there is in the creating a small opening in the tympanic membrane, we call as the myringotomy. So problem is here why you are creating the opening here. So that is there is no any sense in that one. So I am eliminating the option C also, and almost all you people given the correct answer. That is the stapedectomy. The stapedectomy was your Norcet 9 previous year question. Okay, so remember, very important. Okay, stapedectomy means what we will do? We will remove this particular stapes bone surgically. Okay, and we will replace with a external prosthesis. Okay, so that is very important. You have to understand here. Okay, so this condition where there is a stapes bone is got fixed over the oval window, we call that one as the otosclerosis. This condition is the abnormal bone formation around the stapes foot plate, which is causing the fixation of the stapes. Okay, so stapes is got fixed there only and preventing the proper sound transmission in the inner ear. It is not allowing for the sound transmission in the inner ear. Here there is in the problem in the transmission, where there is in the vibrations are not getting transported to the inner ear, so the conductive hearing loss will happen. So this result in the conductive hearing loss. Okay, yes sir. And most importantly, classical clinical features you have to understand here. The progressive hearing loss is the slowly that is the conductive hearing loss. Whenever you will see the tympanic membrane which looks like normal, or there may be even a Schwartz sign will be positive if it is the chronic condition of the otosclerosis. Sir, what is the Schwartz sign? Sir, Schwartz sign means you can see here where there is in the our malleolus attached to our tympanic membrane. Here it becomes the reddish blue or the pinkish blue discoloration of the tympanic membrane happens on the otoscope whenever we will see. So this is called as the Schwartz sign. Schwartz sign is the a sign which is looking reddish or the pinkish blue, so seen through the tympanic membrane during the otoscopic examination. So this will be seen in the otosclerosis. Okay, yes. So next most important point you have to understand, which is favorite of the examiner, that is the paracosis willis. What is the meaning of this one, sir? Paracosis willis. So it means when the patient will be in the silent area, and if I am talking to him, he is unable to capture my word, but when I will make the patient to stand in a noisy area and I am talking to him, he will be able to hear that one. That is called as the paracosis willis. Okay, so paracosis willis is the hearing is better in a noisy environment. Okay, so this is very importantly seen in the case of the otosclerosis. Okay, and this one usually affects in the young adults only, not in the children's and not in the old age people. So usually it will be in a young age children's only. So I hope it is very much clear to every one of you, right? Yes, sir. And here we have the surgical management of our otosclerosis. That is just we are doing the stapedectomy. So that means the fixed stapes bone was there that we are removing and we are replacing with a prosthetic implant. So this is very important. You have to understand, and very easily your understanding the concept, because we are making it in a very perfect, very easy. Same thing you will learn more better and the more graphical, more futuristic, more image based in the plan A1. Okay, so that is very, very important for the next upcoming Norcet 11 and Norcet 12 aspirants. Okay, so if you are preparing for the Norcet 11 and 12, so you can enroll the course that is the plan A1, the one plan for everything. Okay, yes. So here we have the next question. The next question is here. The question is very simple. The otoscopic examination is revealing that there is in the central perforation of the tympanic membrane. So in the tympanic membrane in middle, there is in the perforation, means there is in the breakage is there. With intact ossicles. Ossicles means we have the three bones in a one ear, that is called as the ear ossicles. Those ossicles are not damaged, that is intact only, that is perfect. And a surgeon is now deciding to repair the perforated eardrum using the graft. So very important. This word is the game changer of this particular question, because in the option you will get the two options which looks like similar, but those are not similar. Okay, so the surgeon is decided to repair the perforated eardrum using the graft. Which of the following is the most appropriate surgical management he is going to do? Option A, myringotomy. Otomy means we are opening the our tympanic membrane. So whether he is opening the tympanic membrane, no, already it is perforated, so that one he is making repair. So is that option A is correct? No sir, it is not correct. Mastectomy is unrelated option. Hyoidectomy is not even close option, it is completely unrelated option. So we have only one option, that is the myringoplasty. So the repair of the tympanic membrane we call as the myringoplasty, and opening of the tympanic membrane we call as the myringotomy. So yes, tympanoplasty also correct. Okay, so that is tympanoplasty also word, myringoplasty also word, both are same. Okay, yes sir. So this one you understand here. We have the myringoplasty. Myringoplasty in the sense just we are surgically repairing the perforated tympanic membrane. Already tympanic membrane is got perforated. That one we are surgically repairing. Okay, that is what we call the myringoplasty. And we have the myringotomy. So otomy means open. Okay, so that is any pus filled cavity is there in the middle ear. So that pus we want to remove. So that time I am making a small hole in the tympanic membrane to drain out that pus and fluid which was accumulated in the middle ear. So that time I am creating a small opening over the tympanic membrane, so we call it as the myringotomy. Myringotomy is a small incision made on the tympanic membrane to drain the middle ear fluid or the pus. So this is very important. We have to keep in our mind. Okay, here it comes to the next question. Yes, well done, every one of you. So correct answer. Yes, what is the answer for this question? What may be the answer for this question? Don't miss this particular class. After the first 6 questions, you are going to get the very important questions. That is definitely one out of them will strike in your exam. It may be a 2 or 3 also may strike in your exam. Those kind of the questions with their golden points I have brought in front of you all. So let's finish this remaining questions what we have and we will move further. Okay, so here is the question what we have. A 40-year-old patient is there who is presenting with a recurrent episode of the vertigo. The very, very important question, and I am giving this question as in the 10 star question for your exam. So what happened here? There is in the recurrent episode of the vertigo is there, and the patient is having the tinnitus and fluctuating hearing loss is there, and patient is feeling of the fullness of the ear, means inside the ears he is feeling something is filled. So that is the feeling of the fullness of the ear is there. The doctor is advises dietary sodium restriction as a part of the management. Okay, so now doctor is advising a dietary sodium restriction to manage this condition of the vertigo, tinnitus and hearing loss. So what is this condition is most likely? What we can call this one? Option A, otosclerosis. I just only discussed about the otosclerosis. There is the fixation between the oval window and our stapes bone foot part. So that is the otosclerosis, where we have seen the Schwartz sign and the stapedectomy as a management. So this is not related option to this particular question. I am eliminating option A. Otitis externa we have done as the swimmer's ear. Staphylococcus aeruginosa as the most common sign, and the high risk is, and in the history the patient is having the exposure to the frequent waters. Okay, so there is in the frequent exposure to the waters. So that was the otitis externa or the swimmer's ears we have done. And acute otitis media or the glue ear or the acute otitis media. So the streptococcus pneumoniae, so we have done in the last class as a very perfect with all the golden points revision. The middle ear infection due to the streptococcus pneumoniae, right? So the relationship between the eustachian tube and the middle ear infection, so that is high risk in the children's, because in the children's I told the eustachian tube is wider, eustachian tube is shorter, and eustachian tube is horizontal. So the drainage of the secretion not happens from the middle ear, and it will allow the easy entry of the bacteria from the upper respiratory to the middle ear. So the acute otitis media, so we have seen in the last class only. Okay, so where I have told you about the cartwheel sign, lighthouse sign, so that is suppurative means pus forming otitis media. So that is a suppurative acute otitis media we have discussed. Okay, so this is also not a correct answer for this one. So here we have the option C. So here we have the option C, that is the Meniere's disease, and almost all you people given the correct answer. So that is, I'm very proud of you. So because you people have worked, okay, so that is the reason you know everything. Just believe in yourself. Everything will comes to you in a right time, in a perfect time, and God is planning something big for your effort. So He will definitely give the reward. Just believe in you. You people giving the all correct answers. So still you people worry whether my exam will clear or not. So you are giving the all correct answer. Same thing you go in your, like how you are coming to the Nagraj sir class. Okay, so with the consistency, same thing you go to your exam with the confidence, belief, fearless. Okay, approach the exam by analyzing the things. Definitely result will come. Don't fear. Everything will get okay. So when you will be confident, so you be confident. So your confidence is the key for your success. Okay, consistency people maintaining. So along with the consistency, be confident. Okay, so that is the one what your final result will be decided. Okay, yes, so the Meniere's disease is going to be a correct answer. Now tell me, what is the another name of the Meniere's disease? So that is the endolymphatic hydrops. Sir, what it means, sir? What is the Meniere's disease, sir? So here we have a labyrinth. Okay, so that is outside one we are having is the bony labyrinth. Okay, so outside one we have is the bony labyrinth. Inside this one we are having a labyrinth, we call that one as the membranous labyrinth. Okay, so this is what I am drawing now. So this is the membranous labyrinth. So this is the membranous labyrinth we have. So inside this membranous labyrinth we have the fluid. So that is called as the endolymphatic fluid. Okay, so that is called as the endolymphatic fluid. Okay, so this is the membranous labyrinth, this is the bony labyrinth. Here we have the fluid, that is the perilymphatic fluid. Between the membranous and bony labyrinth the fluid is there, so that is called as the perilymphatic fluid, and the fluid which is present inside the membranous labyrinth, so this called as the endolymphatic fluid. So here the fluid which was there in our membranous labyrinth, that is the endolymphatic fluid. So this endolymphatic fluid, it will increases. Okay, so when the endolymphatic fluid will increases in our inner ear, so that is called as the endolymphatic hydrops or the Meniere's disease. Meniere's disease is equal to endolymphatic hydrops, because here there is an abnormally excessive increased endolymphatic fluid we have. So this is called as the Meniere's disease or the endolymphatic hydrops. So here we have the problem. This is the cochlea, so which is responsible for the sensory function of our hearing. So in the cochlea there is in the pressure is there due to the increased filaments, there is in the sensory neuronal hearing loss. Okay, which will send the same problem to our vestibule and the semicircular canals. Okay, here we have the vestibule and the semicircular canals, same thing will be going to them also. So there is in the vertigo and tinnitus will be there. Okay, so vertigo, tinnitus is there because there is in the problem which is going to the our vestibule also, and problem is there in the our cochlea. So the patient will be having the three very important classical triad, so that you must and should remember. That is the TVS, that is the tinnitus, and the most important vertigo, and the sensory neuronal hearing loss. So the tinnitus, vertigo, sensory neuronal hearing loss. So these 3Vs is the very important triad symptom of the Meniere's disease. So please do remember. Okay, so that is very important. Meniere's disease is a disorder of the our inner ear. So this is the problem of the inner ear, okay, which is caused by the excessive endolymphatic fluid. Okay, so that is the reason we also call this one as the endolymphatic hydrops. Okay, yes sir. So classical triad is the TVS, that is the tinnitus, vertigo, and sensory neuronal hearing loss is the classical triad we have. Most importantly, the doctor will advises you, or the nursing officer will educate our patient to reduce the salt in the food, because if the fluid in the vein is reducing, means endolymphatic fluid also will reduces. So here we are having the less salt, means so there is no fluid reabsorption from the kidney, means the fluid in the vessels will decreases. So the decreased fluid retention, okay, and reduced if the fluid retention is reduced, means obviously the endolymphatic fluid also will decreases. Endolymphatic fluid is decreasing, means so there is in the decrease in the pressure in the inner ear, the symptoms will get releases. So the salt restriction diet, can we give or not to the endolymphatic hydrops patient? Yes, obviously we have to give the salt restricted diet, and this was the your RRB second shift question, so 2026, right? So this is very important. Here is the next question. So yes, here the another management. So we can use the diuretics also for the removing the fluid which was accumulated in the our endolymphatic membranous labyrinth. So in that one fluid is accumulated, so we want to remove that one, means we are giving the diuretics also. And some vestibular suppressants, that is the beta histamine also will give. So in order to reduce the symptoms like vertigo and tinnitus, in order to reduce that one, we will give the vestibular suppressants also. Okay, yes sir. And here it comes to the next question. So please do read the question and give the correct answer. Confusing question as compared to last. This question is the confusing. Okay, so take your time, analyze the question and give the correct answer. Okay, so both are same. Here also we are having the vertigo, here also we are having the tinnitus, here also we are having the hearing loss. Same thing. TVS was also there in the last one. So that is the tinnitus, vertigo and hearing loss. Also we will see in the Meniere's disease, and here in this condition also we will see the vertigo, tinnitus and the hearing loss. But there the patient was having the feeling of the fullness in the ear because the fluid was accumulating. Okay, so here fluid was accumulating. So here because of that, when the patient was having the feeling of the fullness in the ear because the excessively endolymphatic fluid was increasing here, right? Yes sir. But in this question it is not mentioned, right? So it is not mentioned. You can see it is not mentioned. The patient presents with a severe vertigo, nausea and vomiting, tinnitus and hearing loss. Doctor diagnoses this one as the labyrinthitis. So the doctor is diagnosing this one as the labyrinthitis. What is the labyrinth, sir? Labyrinth is the, so that is a portion of the our inner eye, so that including the cochlea and the vestibule and the semicircular canals. So if there is any infection, inflammation is happening to this area, so that is called as the labyrinth. Okay, so that is called as the labyrinth. Okay, if the infection, inflammation is happening to that area, that is the labyrinthitis. Okay, so inflammatory disorder affecting the labyrinth of the our inner ear, right? So which of the following is involved in this particular labyrinthitis is the question. Option A, tympanic membrane and ossicles. No, so this is the part of the our middle ear. We are not considering this one as a labyrinth. It is not a part of the labyrinth. Option B, the external auditory canal and tympanic membrane is not a correct answer. Again, it is the external auditory canal is the part of the external ear, and tympanic membrane is a part of the middle ear. And the cochlea we have here, the cochlea, yes sir, cochlea, vestibule, and semicircular canals. So these three parts are the part of our labyrinth. So it is made up of the bone outside and the membrane is inside. So we are having the two types of the labyrinth, that is the bony labyrinth and the membranous labyrinth. Inside the membranous labyrinth we have the fluid called as the endolymphatic fluid. Okay, if that fluid is increased, that is the endolymphatic hydrops. Okay, so if the inflammation happens of the cochlea, of the vestibule and of the semicircular canals, so we call this one as a very important labyrinthitis. Okay, so that is the inflammation of the inner ear. Okay, and here we have the semicircular canals. This is the semicircular canals, and here we have the nerve fibers. This is the 8th cranial nerve. Cochlea we have, and eustachian tube we can see. Already we have done this one in the last class in a very perfect. So I am going to tell you now what is the labyrinthitis. That is the inflammation of the inner ear, especially to the semicircular canals and to the vestibule and to the cochlea. Okay, so the cochlea, vestibule and the semicircular canals are getting inflammation, so we call that one as the labyrinthitis. Very important, right? So labyrinthitis is the inflammation of the inner ear, that's to the labyrinth, which affects the hearing and balance, because so it is affecting the our cochlea, that is responsible for the hearing. Cochlea is responsible for the hearing and vestibule is responsible for the balancing. Both are getting inflammation, means here the hearing and balance both are getting altering. So that is the reason the patient will be having the problem in the balance, that is the vertigo is there, and problem in the hearing, that is the because cochlea is involved. Okay, so that is very important thing. And the semicircular canal also get inflammation here, so the patient is also having the detection of the head movement and the like he is difficulty in the balancing of the his head movement. So that is the very important thing we have to keep in our mind. Okay, yes sir. And here we have the next very important thing, so that is your image based question. So please do remember this one. So what is this? This is the asepto syringe. Okay, so this is the asepto syringe. So for what purpose this asepto syringe we are using, sir? So any idea for what purpose we have to use this asepto syringe? Yes, so this is simple manual suction syringe we have. So this one will be used for the irrigation purpose and the suction purpose. Okay, so that is in an intraoperative also, any minute blood is there, that time you want to suction, you can suction with this one. And in order to irrigation of the ear, in order to apply some little suction in the ear, so that time we can use this particular asepto syringe. This is used for the irrigation and suction both in the ear. Okay, so that is very important. And it is also used in the other thing also, like intraoperatively what I told to, like to irrigate and to suction a small amount of the blood. Okay, and here we have the next very important image. So this is your purely ear wax removal syringe. So this is the by irrigation of the ear. So we have to remove the ear wax. You know, ear wax accumulation is the most common cause of the conductive hearing loss. So in that situation we want to remove the ear wax. Okay, that time we are going to use this particular syringe. So that is the ear wax removal syringe, what we can say. It is very important for the exam, right? Yes. And here we have the next question. Yes, so do read the question. So question which looks like big but rank deciding question. Okay, yes, there is a 10-year child is there who is brought to the emergency department with severe ear discomfort. So what is there here? The patient is there who is brought to the emergency department having the severe ear discomfort, and there is the budging sensation after playing outdoor. He was playing in the outdoor, so suddenly he got the severely ear discomfort and the budging sensation started in the ear. Okay, so on eye examination, small insect is seen inside the external auditory canal. Inside the external auditory canal, there is the small insect is there. While planning removal, doctor consider the different methods of the removing this one. Which of the following is not? Which of the following is not? So please do remember, exams are near. So these kind of the words here I am giving capital. Examiner may give capital or he will mention small only. Why he want to favor to you? Why he want to help you? He will not help you. He is an examiner. He want to test you. So that is your responsibility how to focus. Okay. So please do focus the word like you, dear. It is important for your rank. Okay, so here the question was there. So which of the following should not be done during the removal of the foreign body from the ear, especially the small insect or any kind of the beans, any kind of the small beans which enter inside in the ear, external ear. So what we have to do that time and what we should not to do that time. So that is the very important. Option A, that is, I will start with the option D. So that is the examine the ear carefully before the attempting removal. Yes, before starting removal, we will examine the ear perfectly. We will see where actually the insect is there, what is the position, which is anything which is bited to the tympanic membrane, which is holded the tympanic membrane. We will see. First, we will examine the ear carefully before attempting of the removal. Okay. Then option B, remove the insect using the forceps and the minimum suction. Yes, we can use the a small forceps to remove that one, or we can use the minimal suction also to remove that one. And option B is immobilize or kill the insect with oil or glycerin. If it is attached tightly and which is not coming, so we can immobilize that one first and we will kill with some glycerin or some other oil we will put in the ear and we will kill that one and then we will remove that one. Option A is telling instill the water into the ear canal. This one is not recommended. This is not recommended. Sir, why installation of the water in the ear canal is not recommended here? Because once you instill the water, so that particular insect which was there, that will die and it will get swell. So after that, inside the body of the insect, the water will get filled and it will get swollen. It will get big in size. So if it is get big in size, it is difficult to remove. Same thing in the beans. Okay, any cereals, beans entered inside the ear. So in that particular situation also, you don't have to put the ear, because if that particular bean or that particular cereals which went entered inside, if it is getting swollen due to the installation of the water, that is again difficult to remove. So that is the reason instill the water into the ear canal is not a method to remove the foreign body from the in a situation where there is on the entry of the foreign body into the external auditory canal. So I hope it is very much clear. Okay, so this is option A. It should not be done. Okay, it should not be done. Okay, so in the question also they have asked which should not be done. So this one should not be done. Remaining thing we can do so to remove the foreign body. Okay, so I hope it is very much clear. And here it comes to the next question. Yes, very important. And now starts your high yield questions. Best discussion. Here we have a patient who is presenting with the three different area inflammation. One is he is having the inflammation in the joint, so joint pain will be there. Urethritis, difficulty in the urination will be there. Conjunctivitis, difficulty in seeing the object will be there. So infection, inflammation of the conjunctiva, infection of the urethritis, so that is the urethra, and the inflammation of the our joint, so that is we have is the arthritis. Okay, arthritis in the sense that is the joint involvement in there in the inflammation. Urethra is got inflamed and the conjunctiva is got inflamed. So what is the nurse suspect on this particular triad? So based on this triad, what the nurse is suspecting here? Option A, rheumatoid arthritis. Option B, Reiter syndrome. Option C, systemic lupus erythematosus, and option D is the gouty arthritis. What may be the condition? Yes. So we have discussed the rheumatoid arthritis, gouty arthritis already in detail in a previous crash course session. So you know here it is not a correct answer, because in the rheumatoid arthritis, urethritis, conjunctivitis will not happen. Gouty also same, conjunctivitis, urethritis will not happen. So in the systemic lupus erythematosus, you know the butterfly shaped rashes and the small and medium sized blood vessels will get inflammation, and the connective tissue is mainly getting the inflammation due to the autoimmune antibodies. That is the systemic lupus erythematosus we have, and that is also not having these three types of the itis. That is the arthritis, urethritis, conjunctivitis. It is not a part of the SLE also. So one answer we have here is that is the option B. Yes, well done. So some of you have given the correct answer. This is the Reiter syndrome. So what is this? This is the Reiter syndrome. So what is the Reiter syndrome? How it happens? Why it happens? So let me quickly discuss this one. So this is a very important question for your exam. So please do keep in your mind. Okay, so that is the patient is unable to climb the tree The scenario based, unable to climb the tree because he is having the arthritis, pain in the joint. How he will climb the tree? He will unable to climb the tree. And patient is having the difficulty in the urination because the patient is having the urethritis, and he is unable to see properly because the patient is having the conjunctivitis. Okay, so these are the clue where you will get in the clinical scenario based questions. Okay, so Reiter syndrome is a type of the reactive arthritis. Okay, so reactive arthritis means, so elsewhere in the body, like in the genitourinary tract or in the gastrointestinal tract, there is the infection. So because of that infection, there is in the autoantibodies are formed, so that autoantibodies are damaging this. Okay, so this occurs after the infection. That is the post-infection autoimmune reaction. It is there. So that is, we can say, reactive arthritis, we can say. Okay, so this one is post-infection autoimmune reaction we have. Okay, yes sir. And the most common trigger for this one is the genitourinary infection, that is the especially chlamydia trachomatis, and the gastrointestinal infection by the salmonella, shigella, and yersinia pestis. Okay, so if these infections are happen, okay, so because of this infection, so there is autoantibodies will form, so that autoantibodies are damaging the multiple things. So that is especially joints, that the arthritis will happening, and urethritis is happening, conjunctivitis is happening. Okay, and the memory trick you have to remember, a patient will say, I can't see properly, I can't pee, means I am unable to urinate, and I can't climb the tree, like this the patient will tell. So this is the memory trick you have to remember for the scenario based question. So I hope it is clear to everyone of you, right? Yes. So that is the Reiter's syndrome what we have discussed. And here we have the next question. This is also a very important question for your exam, so please do pay the special attention on this one. So this is important. Okay, yes. The 52-year-old man is there who is presented with a high grade fever. Fever is there. Okay, and right upper quadrant abdominal pain is there. So right upper quadrant abdominal pain also it is there, means something which is problem with the liver, or else with the gallbladder, or else with the common bile duct. Okay, so that is the right upper quadrant. It is all organs which are having that particular quadrant. So something which is problem in that area. And also patient is having the yellow discoloration of the eyes for the last 2 days. So it indicates there is no jaundice. Fever is there, abdominal pain is there, jaundice is there. So what we will suspect? Which triad is this? So which triad is this? So fever is there, abdominal pain is there, and the jaundice is there. So which triad you want to suspect here? Yes. What is this triad? Let me complete the question. I will come to this one. Okay. Yes. So here we have the yellowish discoloration of the eyes for the last 2 days. It means the jaundice is there. On examination, he is febrile and icteric. Means fever is there and the jaundice is there. Ultrasound is showing that there is in the dilated bile duct. Okay, with a stone in a common bile duct. Okay, in the common bile duct, stones are there, so which is got dilated. What is the most likely diagnosis of this one? So in the question only, answer is also there. You can see acute hepatitis means there should be a problem with the liver. Nothing mentioned in the question, so I'm eliminating the option A. Then option D is the pancreatitis, which is not especially in the right. So right upper quadrant is pain is there. So why pancreatitis? Pancreatitis is there in the left side. So eliminate the option D also. And option C, that is the acute cholecystitis. Acute cholecystitis means, so we should not be get this triad. That is the abdominal pain, jaundice, and the fever. So we may get the sign, but this is not a classical triad of our cholecystitis. Okay, I'm removing the option C also. Then comes to the option D, that is the cholangitis. So what is the cholangitis? It is the inflammation of the common bile duct. Okay, it is the inflammation of the common bile ducts where there is in the predominant this particular triad will be seen. So we call this one triad as in the very important Charcot's triad. Okay, so this is the Charcot's triad. In the Charcot's triad, patient will be having the fever, jaundice, abdominal pain. Sir, why this one? So because of the inflammation in the this particular CBD, there is the common bile duct. You can see this is our gallbladder. If any infection happen to the gallbladder, there is an inflammation. So that is the sorry, cholecystitis, we can say that is the inflammation of the gallbladder. And if there is any stone inside the gallbladder, that is the cholelithiasis. If there is any inflammation in the common bile duct, and if there is any accumulation of the stone in the this particular bile duct, that is the choledocholithiasis. Stone in the gallbladder gland is the, so this gallbladder organ is the, that is the choleolithiasis, and the stone in this particular common bile duct is called as the choledocholithiasis. Okay, so in this particular common bile duct, if the inflammation is happen, means we call it as the cholangitis. This is called as the cholangitis. If inflammation is there in the gallbladder, that is called as the cholecystitis. Cholecystitis is used for the gallbladder inflammation, and the cholangitis is used for the common bile duct inflammation. If here it is got inflammation, okay, so because of this one, the pain will be there in the abdomen and the fever will be there. And you know, so these are the right hepatic duct, this is the left hepatic duct. Okay, so these both will comes from the liver, this both will comes from the liver. So in the liver, unconjugated bilirubin will get conjugate. So that conjugated bilirubin from the liver, it will comes to the this right and left hepatic duct, and from here it will be get excreted into the GI system. So from the GI system into the our what we can say stool, it will get eliminated. Okay, if there is any inflammation here, so it will not allow the bilirubin to get excreted. So here the conjugated bilirubin will be increasing. Okay, so here the increased conjugated bilirubin will be there. Very important. So this will causes the icterus or the jaundice or the yellowish discoloration of the eye. So the pain is there, fever is there, and the jaundice is there. So that is what we call as the a very important triad, that is the Charcot's triad. So this Charcot's triad will be classically seen in the cholangitis. So this is a very important for your exam, and very important for your exam. So you can expect the one question from the Charcot's triad. Okay, so yes, so if in case in a cholangitis, if the common bile duct is got perforated or injured and the bleeding is happening, you consider, so that will cause the hypotension. Along with the Charcot's triad, hypotension, and if hypotension is happening, means decreased blood supply towards the brain, so altered mental status will happen. Okay, so if the Charcot's triad plus hypotension, that is a shock, plus altered mental status, that is the confusion, if this thing is happening, we call this one as the pentad. Which pentad? That is the Raynaud's pentad. Raynaud's pentad is the severe form of the cholangitis, where we will see the 5 signs. So that is the, what are the 5 signs? Are the Charcot triad is having the 3 signs, that is the abdominal pain, fever, and the jaundice. Along with that one, the shock is there. Along with that, the confusion is there. Okay, so this is called as the Raynaud's pentad. Okay, that is the very important thing. So this is in a severe form of the our cholangitis. So you have to remember this one, recently asked in the NEET PG. Okay, yes sir. So next we have this question. What is this? So this is a treatment we are using in a treatment of the cholangitis. So where we are inserting the endoscope. So you can see this is the endoscope pipe we have. Okay, this endoscope pipe is coming here into the second part of the duodenum. So from here, this hole, it is entering inside the our common bile duct. Okay, you can see it came into the common bile duct. So this one, this blue color line. Okay, so this one is coming here, and whatever the inflammatory stones are there here, what are the inflammation condition is there, so that is taking the photos for the diagnostic purpose, and the most importantly, it will remove the all the obstruction form here. So this is called as the both diagnostic and treatment options we have is the ERCP, that is the endoscopic retrograde cholangiopancreatography. It means, so we are coming here, and you know the bile flow will be bile flow from the this one. So this is the direction of the bile flow. Okay, so here we are going against the bile flow, ulta. Okay, so ulta we are going, that is the retrograde. How we are going? With the help of the endoscope. Okay, with the help of the endoscope, we are going ulta, that is the retrograde. So we are going in the common bile duct, that is the cholangio, that is through the pancreatic hole. So that is the pancreatography. So that is the endoscopic retrograde cholangiopancreatography. So this is one of the very important treatment options plus diagnostic option we have in the patient with the cholangitis. So I hope it is very much clear. Okay, yes sir. And here is the just beautiful information who all are preparing for the your juniors, your colleagues, okay, your hospital, any staffs who want to prepare very best and very best for the upcoming Norcet exams like Norcet 11 and 12. We have the very beautiful course, that is the plan A1. Okay, so this plan A1, which is a A1 plan, means all in one, which you will get the classes of 700 hours plus subject wise, very properly, very perfectly arranged classes. Along with that one, you will get the notes of that particular class immediately after that class. Along with that one, you will get the subject wise test of the every topic which we are teaching in the app. Okay, that is very perfectly, which is focused high yielded over the Norcet. And the most importantly, you will getting the daily live test on the daily basis. So live test will be starts from the daily morning 6 a.m. and it will be live till the night 11 p.m. You can attend anytime, so from morning 6 a.m. to night 11 p.m. Okay, so your rank will be get dispatched in the master nursing classes official YouTube official WhatsApp channel. So there you will get your rank. Okay, so that is the A1 is the name, so because it is having the everything in that one. Okay, so it is having the classes also, it is having the daily mock test also, it is having the subject wise test also, it is having the PDF notes also. Okay, so one plan that is for your basic to advanced preparation. So if you are preparing for the Norcet 11 and for the Norcet 12, so Norcet 11 and 12, any of your juniors, anyone is preparing, so please do recommend the course. This is the decider of the rank. Okay, so very important we have. Okay, and if you are preparing for the Norcet 10, here we have the Super 60, the rank booster test series. Okay, so this particular course is now going with a 30% extra huge discount, so you can enroll as soon as possible, because after the Norcet 10 exam the course price will be double. Okay, so that will going to be double. So here we have, yes, the Super 60 test series. So that is a rank booster test we have. So here you will be getting the 350 plus mini test, that is the most important subject wise test, okay, of the all high yield topics. And along with that one, daily live test. Okay, so this is purely a test series plan we have. Okay, so you can enroll in this one. This is the game changer. Okay, so where you will get all the NCLEX based questions, scenario based questions, one liner questions, as same as exactly like your Norcet exam pattern. Okay, so this is the plan we have for you currently. Okay, so here comes to the next question. Yes, so do read the question so completely, and to follow those plans you have to download our app. So the link I have given in the description box, and in the comment box also will get the link. Okay, so here is the question, so please do read the question properly, perfectly, and try to give the best answer for this one. Yes, so there is a 6-year-old child is there who is presenting with a fever, and the sore throat is there, and rough red rash is there, that is feels like a sandpaper. So the clues are there in the multiple clues are there in the question, you can see. So here the child is there, first of all child is there, okay, and he presents with a fever, sore throat, and red rashes, that is rough, that is peel like a sandpaper. So here you can see the sandpaper like rashes. You know this much only means you can put the answer. Okay, so on examination, so tongue is appearing bright red. What is the most likely diagnosis? Here you can see the sandpaper like rashes we have. Okay, so you can see the sandpaper like rashes, and whenever you will see the tongue which is completely red, so we can call this one as the strawberry tongue. So we can call this one as the strawberry tongue, right? Yes. So these are your options we have. Okay, so what is the answer for this one? Option A, measles. Option B, scarlet fever. Option C, dengue fever. And option D is the rubella. What is the correct answer? I'm waiting for your answer, so fatafat do mention it. Yes. Well done. So this is a classically answer goes to the scarlet fever. Okay, very important. And we have the one more very important area where we will get the strawberry tongue that may confuse you in an exam. That is our Kawasaki disease. Sir, what is the Kawasaki disease? That is the autoimmune mediated disease where it is damaging the medium sized arteries. So it will be manifesting with the strawberry tongue. But the main very important thing is in the Kawasaki disease, there is no any sore throat history will be there. There is no any sore throat history. And in the Kawasaki disease, that is the autoimmune mediated and this is the infection mediated. Getting the point? Yes, sir. So there the medium and small sized arteries are damaged mainly, and here the multiple organs also involved in the scarlet fever. Okay, so we'll see what is the scarlet fever, what is the cause to organism, what is the treatment, everything in detail in perfect, because this is very important for the exam. So in the question, if you are finding the sandpaper rashes, this is the hallmark picture of our scarlet fever. Strawberry tongue is the classical sign, and the group A beta hemolytic streptococcus is the cause to organism. So these are the rank and these are the answer deciding clues what you have in the question. Okay, in the scarlet fever, so there is a cause to organism we have is the group A beta hemolytic streptococcus, very important. And the classical symptoms we have, the fever is there. Along with that one, there is the sore throat history. So the sore throat, most common organism is the group A beta hemolytic streptococcus. So that is the sore throat history will be there. And the rashes are sandpaper like rashes we have, strawberry tongue, and there is in the circumoral pallor, which means flushed face will be the completely red face. Along with that one, the surround of the mouth, there is in the pale is there. Okay, so flushed face with the pale around the mouth. So this is the very important thing to be keep in our mind. Okay, yes sir. And next we have, that is the characteristics of the rash. So rashes will be here. It will be starts in the chest and neck first. So in this particular area, it will start first. So from here, it will spread to all the area. Okay, and it will feels rough. Okay, it is not in the like other rashes. It will be a rough rashes. Okay, which will be sandpaper like rashes. Okay, and we have the rash in the skin fold. So we call that one as the Pestias line. Okay, so what is the Pestias line, sir? So Pestias line is the skin fold of the that particular child is having the multiple rashes, so we call that as the Pestias line. So that will be seen again in the scarlet fever. Okay, yes sir. So the scarlet fever is the one of the very important for your exam. So from here the multiple time questions was asked. So now tell me, this is the question for you only. Yes dear, to you only. What is the drug of choice for the scarlet fever we have? Yes, what is the drug of choice? Yes, everyone who all are live to the comments, who all are live to the class, everyone I want to comment here. Okay, so all are live to the class, so fatapat comment. Yes, very nice. So that is the, we have the penicillin as a drug of choice for the scarlet fever. So the next is the most common, a very important complication of the scarlet fever. If you are not treating this one properly, it will get converted into the acute rheumatic fever. Okay, so that is very important, you have to remember. And most commonly affected heart valve here. So that is the which valve which will affect mostly in the rheumatic fever. So the same valve which is affecting here, that is the mitral valve. So in the scarlet fever, rheumatic fever, the most commonly affected valve will be the mitral valve. So these three words are very important, and from here you may expect the question in the exam. Okay, so from here you may expect the question in the exam. That is the very important for your exam. Drug of choice, most common important complication, and the most commonly affected valve. So this is important for your exam, and this was the examiner favorite point, that is the mitral valve. In both acute rheumatic fever also mitral valve is involved, and the most commonly involved one in the scarlet fever also our mitral valve. So I hope it is clear. Next we have this question. So please do read the question and give the answer as the very best answer. There is a 45-year-old man is there who is presenting with a routine checkup, who is coming, and he is having the increased abdominal girth. So abdominal girth is increased, it means the central obesity is there. Okay, yes sir. And the blood pressure is 150 by 95 mmHg. So hypertension is there. Fasting blood glucose is 130 milligram per deciliter. So the hyperglycemia is there, obesity is there, hypertension is there, hyperglycemia is there, and lab test revealing that there is in the triglycerides which is elevated, increased triglycerides, and low high density lipoprotein means the bad cholesterol which is there, that is increased, that is the elevated triglyceride, and the good cholesterol, that is decreased. So he has the sedimentary lifestyle, and the BMI is of around 31 kg per meter square. What is the likely diagnosis of this? So very simple, you have to think very clearly. The patient is having the hypertension, diabetes, obesity, and more bad cholesterol, less good cholesterol. So this is classically indicates of metabolic syndrome. So that is very importantly, and yes, almost all people given the correct answer. Okay, so this is the metabolic syndrome is goes to the correct answer. Okay, so this is very important for your exam. You have to keep in your mind. Okay, yes sir. Right, yes. So here we have the very important diagnostic criteria of the metabolic syndrome. So this is very important for your upcoming Norcet. So this is the trending question which may strikes. This is now most trending question we have. This may strikes in the Norcet. Okay, so very importantly, we have the 5 very important criteria here. Among this one, at least 3 should be there. So then we will say this one is the metabolic syndrome. Otherwise, we will not say this is the metabolic syndrome. Out of 5, any 3 should be positive. Okay, so we have here we have the abdominal obesity. That is the waist circumference is more. So that is central obesity. What we can say, the central obesity in the man is more than 1 or 2 centimeter, and for the woman more than 88 centimeter. So this is depends on the geographical area. So this is our related to the ASEAN people. So that is I have taken. Okay, so next we have the triglycerides. If the triglycerides is more than 150 milligram per deciliter, so that is the high bad cholesterol, what we can say, and the high density lipoprotein, that is the good cholesterol. It is less than 40 in the men and less than 50 in the woman. So there is low good cholesterol. Blood pressure is high, that is more than 130/85, and fasting blood glucose is more than 100. So this all thing will be a diagnostic criteria. Okay, so in the question, the fasting blood glucose level was the 130, means which was more than 100. So means we can say high fasting blood glucose, that is the hyperglycemia of the diabetes. And in the question 150/90 was there in the BP. So it is more than 130/85. So there is in the hypertension is there. Diabetes, hypertension, and the obesity, and the high bad cholesterol, low good cholesterol. So this indicates there is in the metabolic syndrome. So this is very important, you have to keep in your mind. Okay, yes sir. So these are the criteria. So out of 5, at least 3 should be there. Okay, and this indicating the metabolic syndrome. And the most important feature of this one will be the central obesity, and the main problem here is that is the insulin resistance. So that is the insulin resistance is causing the again further increasing the obesity, and most importantly, insulin resistance means the blood glucose level will be high, and the obesity will again cause the hypertension. So these are interrelated one and each. Okay, so the main thing we have to ask the patient here is to reduce the body weight and increase the sensitivity of the insulin. So because obesity is the most common risk factor for the insulin resistance. Okay, so reduce the obesity, increase the insulin sensitivity, and the thing will come to the normal. So this is very important, we have to keep in mind. Okay, yes sir. And here we have the next question. A nurse in the emergency department, she notices that suddenly patient is having the severe pain in the left leg. On examination, the limb is cold, pale, and pulseless. The patient also complains of the tingling and inability to move the limb. What is the most likely diagnosis, or the what the thing nurse should suspect of these cases? So we have the deep vein thrombosis in the option C. Option B, we have the cellulitis. Option C, we have the acute arterial occlusion, and option D is the chronic venous insufficiency. If the pulse is decreasing, so in the given a question, so there is in the nurses in the emergency department is noticing the suddenly developed severe pain in the left leg. On examination, limb is cold and pulse is pulseless. So like limb is completely cold and pale and the pulseless. Okay, so pulselessness is there, which means vein blocked or artery blocked. You think pulse is felt by artery or vein? So pulse will be felt by the arteries, right? So here the pulselessness is there, and the limb is cold means the warm blood is not going towards the limb, again artery blocked. Limb is pale means the oxygenated blood is not going towards the limb, means again our artery is blocked. So what is this condition? Yes, I want everybody's answer in the comment box. Okay, so of this particular question, and I am going to discuss this particular question in the next class with all the image based questions of the treatment of this particular condition what we are going to discuss on. So that is and I will tell you here we are going to use one catheter, that is the Fogarty's balloon. Okay, so that is Fogarty's balloon is the clue for choosing the correct answer for this question. You can choose in the yes. So well done. So almost all you people given already correct answer. So please do mention the same in the comment box. Okay, so we will meet again with a more important question. So thank you so much for watching the class till here. Okay, so stay connected. You will be getting the a more important question such this. Okay, so I am going to cover the all the high yield and the very important focused topics. Okay, so from the today, so just be bold, be confident, and give your best in the daily test practice. Okay, don't miss any super 60 test. So that is the game changer. I am telling one more time. Okay, so thank you so much for watching the class till here. Okay, so please do hype the video also, that will helpful for us. Okay, so please do hype the video at the end of the video. Bye bye, take care. We will meet again, right? Yes, thank you everyone. Thank you.